Jew. On today's episode, the spoken and unspoken Black women in healthcare. Dr. Jew shares her inspirations from historic Black women and their impacts on modern medicine. This episode is filled with knowledge, insights, and so much more as Dr. Jew delivers.
Hey everybody, it's Dr. Jew with Dr. Jew Delivers. Welcome to my channel, Between You, Me, and the Speculum, where we address healthcare issues, especially facing women, Black women in particular. And so today I just completed a podcast. I will let you know when that is to air on a new podcast that will be airing beginning this fall. And part of the conversation, the host of that show asked me about the relationship between physicians and their patients. And I, as a gynecologist, answer that very candidly. I don't believe that I, even as fabulous as a physician I believe I am, I don't believe that I may be the best physician for everybody. It's about relationship. And you may be a good person, but that doesn't mean you get intimate with every person you meet. And it's definitely intimate time, and you are allowing someone to take care of you. But what it made me think of, and I wanted to share today, were just giving some voice, some names to some Black women in history that unfortunately we have come to know at different times. If there was social media back in the mid 1800s, we would know the names Betsy, Lucy, and Anarcha. But that trio of enslaved women were the women that are very well documented. This is not myth, although in our country it appears that people are trying to erase our history. It is not myth, and has even been written by Dr. J. Marion Sims himself. So Dr. Sims, very well known by name amongst all gynecologists, because there are a handful of instruments that are named after Dr. Sims. Sims retractor is one that comes quickly to mind. And Dr. J. Marion Sims was dubbed the father of modern gynecology till a few years ago, when the story of Betsy, Lucy, and Anarcha came to light and more people understood and learned about who they were. But Anarcha seems to get most of the attention because she was known to be a teenager. And in that time, the slave owners, this was, Dr. Sims worked out of a small town in Alabama. In those times, the slave owners did pay for health care, if you will. And Dr. Sims, in his season of practice, he sought to fix the women. And what do I mean by that? So Black enslaved women were extremely valuable, right? They were extremely valuable to their slave owners on those plantations, because not only did they do the work, but they also produced more slaves. So I paid for you, but now how many babies, how many workers can I get out of you? And there was a very known complication called a vesico-vaginal fistula that oftentimes plagued women. They suffered with after they delivered a baby. So of course, you're not thinking about a hospital or even a home delivery that is performed methodically under the care, watchful eye of nursing staff, sometimes with doulas and midwife or perhaps an obstetrician nearby. But they were delivering out in on the property and not so sanitary sheds. And anywho, it's very well known that the method of delivery was a little bit more barbaric before modern days. And so
What happened that night? You said things were fine. What changed? What are you avoiding? Men, talk about it. Why can't we?
Hi, I'm Dr. Julianne Adams-Burt. 43% of women experience a sexual problem, yet they don't want to talk about it. We can help you feel the way you used to. So talk to us. Visit radiantwomenshealth.com today. These women oftentimes with the delivery could have major tears, and a fistula is a channel that forms between two organs. That shouldn't be there, right? This isn't like the esophagus going to the stomach. That should be, that channel is there. But it's, excuse me, an artificial, unnatural formation of a passageway or channel between two organs. And so with the trauma of delivery, these women could develop vesicle, which means the bladder, vaginal fistula. So there would be a tube-like channel between both of those organs. So essentially women would be urinating not just from their bladder via the urethra as normal, your pee hole, but it would be coming through the vagina. And we need to get these women back, working, whether they were in the house or if they were out in the field. We need to get them back working. We need them to heal quickly. So not only could we mobilize and utilize their bodies, but utilize them as baby making machines. And the story of Anarcha, tragically as it's told and understood, at least 30 surgeries were performed before the age of modern anesthesia, which did come later, but without anesthesia. 30 operations where tools, sharp tools, were taken to her body and her pelvic region to construct and to repair this fistula so she could get on her way and doing good for the master. So we think about Betsy, Lucy, Anarcha, and then I think about Henrietta Lacks. You probably have heard the name. Henrietta Lacks, who at an early age, 31 I believe she was, she went into the hospital and she had unusual bleeding after her last delivery. She had multiple children with her husband, and before the year's end, she died. And the story of Henrietta Lacks is sad because it was before the days of informed consent. When I have a patient who comes in for pre-op assessment, evaluation, and consent, I go through all of the steps. I go through alternative procedures that she may decide on. I talk to her about the risks and I talk to her about the benefits. And then you have to sign your little John or Jane Hancock on the line. It's a way to protect you. It protects doctors somewhat, not all the way, but it's more to make sure we have checked off that list. I've talked to you about your fibroids and why you need or why you've decided on having a hysterectomy, but to make sure that I've talked to you about the other options, that you don't always need a hysterectomy. Sometimes you may benefit from a myomectomy. So instead of taking a whole kit caboodle, we just take the fibroids out of the kitten, or whatever. We take the fibroids out and leave the uterus. And now there are so many other procedures, ablative procedures, embolization procedures, too much for today's topic, but were you aware of all of your options? Or were you aware that if you chose that hysterectomy, that you may be at risk for complications from it, even unto death? We call that informed consent. What are your options? What have you chosen? What are the ramifications of it? What are the consequences, potentially, risk, benefits, so on and so forth? So Henrietta Lacks, without informed consent, her cells were taken and they actually became pivotal in health in America, pivotal to vaccine formation. Polio was the vaccination against polio, eradicated polio in this country, thanks to Henrietta Lacks. The understanding of cervical cell cancer, I forgot to say, I omitted that the bleeding that she was having soon after her last delivery was because she had malignant cells on her cervix. And then those cells were able to be studied and replicated. So we called them the immortal cells of Henrietta Lacks because they were uniquely able to be regrown by the absolute millions. And because of her life sacrifice, we have things like, again, vaccinations, not just polio, but it even helped with the understanding of HPV, the human papillomavirus that causes cervical cancer, 99.5% of them, and the vaccine now that we know and encourage young women and young men to receive, to fight against that. All of this was done not only without consent, but it's also done without her family's knowledge for years. I believe it was not until into the 1970s. And then most recently, we are happy that there was some compensation awarded to the descendants of Miss Henrietta Lacks. But again, black women have historically been used as essentially guinea pigs. Even, I think back to until 1972, the syphilis, the Tuskegee famous, we call it the Tuskegee experiment. And what that was, about 600 men, I believe, that were studied. They wanted to study the impact, what syphilis looked like, what it did, how it transformed throughout the years and decades in a man's body. And the reason I bring it up, even though I'm talking about healthcare and its impact, the danger of impact and its impact on women, is because those men were with somebody. They had wives, they had family members, they had loved ones who were also impacted. Those women easily were delivering babies. And now we understood and learned more about neonatal syphilis, right? So there's primary, secondary, tertiary, and neonatal syphilis. And this, what I'm sharing with you, is the injuries to black women in America. We learned at some point that penicillin was the cure, and it was withheld. It was withheld. So these men, and we ain't even gonna talk about men and their part in the injury to the women. But in healthcare, we need to know better and do better. And even though penicillin was known in the years that this study was taking place, it was withheld. Withheld from the men, withheld from the women, and I'm sure withheld from the babies. So I think about Anarcha, Betsy, Lucy, Henrietta, and all the nameless women who were offshoots of the injury due to the Tuskegee study. Oh boy, so many other women who have been impacted. Our sisters, our cousins, you perhaps. I think about the women, also stories. It's not just Alabama, so forgive me for talking bad about Alabama, but I even had a patient once who told me the reason why she never had children is because when she was a young girl, her mother was told that it was best that she have surgery, and she had a hysterectomy at a young age for a non-malignant, meaning not cancerous reason, but she had surgery. And these oftentimes were done under the guise of one thing. Perhaps it was because she had really heavy periods. Well, even back in the 70s, we knew other ways to manage heavy periods. And she was never fortunate to have children. Another patient similarly also never had children. She was I remember she told me she was raised in Florida, but she too had surgery as a teenager, removing vital organs to help her to be able to become a mother as well.
When did this begin? How long has it been going on? Did you think it would just go away? Men, talk about it. Why can't we?
Hi, I'm Dr. Julianne Adams-Burt. 43% of women experience a sexual problem, yet they don't want to talk about it. We can help you feel the way you used to. So talk to us. Visit radiantwomenshealth.com today.
So many nameless women who have been impacted, because just like in Dr. Sims' case, there is this notion that Black women are immune to pain, like we have a higher pain tolerance. I can tell you that happened when I was doing obstetrical care. I've seen the differences in certain patients who maybe they didn't get their pain medication, even up to an epidural, as quickly as some of my other patients. And yes, we would speak to it, and but it doesn't mean that there's not an implicit bias that happens. Kira Johnson, I think about her in 2016, who lost her life after having a healthy pregnancy. I had the blessing of sharing the stage on a local syndicated show, the Portia Show, with her surviving husband. They had 2 boys. They were having a scheduled C-section, their second C-section out in California, and scheduled C-sections, the reason why, and I've spoken on this before, the reason why that's important when I say scheduled C-section, because we know in healthcare that when things are done with precision, with scheduled timing, risks are lower. Now, if you are in labor and it becomes an emergency, right? Everything is flying. People are flying in, tubes are flying, needles, extra access, all of the things. Papers are flying because we need you to sign consents because there's a worry, there's a concern. We got to get you to the back, got to get you cut. But a woman who's having a planned, scheduled C-section, and I've had 2 C-sections, neither of which were planned, which increased my risk of complications occurring. But Kira Johnson went in on that day, 2016. Wow, next year her son will be 10. In 2016, and she gave birth, and it was not until after delivery she was having just pain, and my understanding she was having, she was kind of losing consciousness, I would say. And per her husband, Mr. Johnson, they noticed that there was blood coming from her Foley catheter. That's the bladder bag, if you will, that they kept in during surgery and even after. And he was told when he, I'm sure multiple times, but at one point when he went to the nurse's station, that your wife is not priority. And I recall, I've delivered over 4, maybe closer to 5,000 babies in my lifetime. And I know that there are days when crap is hitting the fan. And you have to prioritize. If you don't have someone else to come in and take over or assist, you gotta say which is most urgent. Just like in an emergency room, they're having to decide. That's what triage is. They're deciding who is the most critical at this moment. We got to address this, address that. But you cannot forget your normal, I would guess you would think, mundane teaching, right? There is blood in the Foley bag. And never had the opportunity to read through her medical chart, so I'm not going to say that I have read all the things. But as an obstetrician, still board certified obstetrician, just don't do it anymore, that case in particular pains me. And not that no one is deserving of such an ending, so tragically. But I will tell you that there are certain patients that do increase your risk, right? And she was none of those things. She was a healthy woman. Unfortunately, her being an educated woman actually did increase her risk. Ain't that a blip? That being a black woman in America with a higher education, you have higher risk, 3 to 4 times more maternity risk, mortality risk of dying in pregnancy, in labor, and even after than a non-educated white woman in America. An educated black woman, greater risk of dying than an uneducated white woman. Let that sink in. So, Kira Johnson, we wanted to say your name. There are, Dr. Who am I thinking? There was not a doctor, another patient. Sorry, I'm out here on Columbia Drive. I was getting my walk on. As you can see, my kids are in the back at track practice. So I'm out here in the elements and the sun, beautiful sun. So street's right there, so my apologies for all the background noise. But there was a young woman, Isaac, I believe was her last name, she too died in 2017. In 2017, while having a cesarean delivery, I believe it was her first baby. So the father of the baby is raising that child. And the sad thing about her, when you look her story up, she was verbalizing how she was feeling dismissed during her prenatal visits, during her care. And then, oh my gosh, Dr. Shalon Irving, I believe is her name. She was a CDC epidemiologist. She had her PhD, y'all, doctor. And guess what she studied? She studied systemic racism and how black maternal mortality was a thing and what we could do to reverse it in America. And then she became a victim 3 weeks after delivering her baby. She became a victim herself, dying after the delivery of her first child. Wow, we want to pay some respect, say her name. And then I think of the near misses. Studies have shown we talk about the 3 to 4 times more likely risk of black women dying in birth, right? And the number of women who just suffer. They suffer. I'm running away from a bee, y'all. Forgive me. That was a bee. I don't do bees. She suffered that the number of near misses, the women who suffer but don't die, right? There's tragedy in that. I'm gonna look real quick. Then there's Dr. Susan Moore. Dr. Susan Moore was a colleague in Indiana. She was a black woman physician, family physician. In December of 2020, during COVID-19, right before vaccinations were fast-tracked and available, she was in a Facebook group. We were in a Facebook group together, and she was coming on doing lives from her hospital bed, sharing her own plight, sharing that she was not being taken seriously. And she says, and I can't quote it verbatim, but I will summarize and said, this is how and why black people are killed in America. And she died because, as she shared in her videos, she wasn't taken seriously, her health needs. She was sent home from one hospital, I believe, went to another hospital, and she died. Oh, Then I was sharing about near misses. Near misses are the ones when the women die. I think about Serena Williams. Serena, who said she had suffered in the past with blood clots in her lungs. Pulmonary embolism is what it's called, or emboli, plural, and was not being heard. She wasn't being heard. And she ended up with swelling. She knew the signs: chest pain, difficulty breathing, swelling in your legs. Maybe, I don't know if she had a DVT, which is a deep vein thrombosis, where it actually starts in the calf and then it can break off and come to your lung and make it difficult for you to breathe. Serena, I mean, if you can't have education, you can't have money, despite being black, and still nearly die, what is that saying about healthcare in America? So let's talk about what we're going to do about it. I've given so many examples, and there's so many people without a name that I can share who experience losses, who experience near losses, and the impact even for the near misses continues on and on. What if that woman wants to continue growing her family, and she recalls what happened the last time? It's just so much. The myth that we don't experience pain. I remember my own experience with a patient when I was still taking care of prenatal patients. I had a patient with sickle cell. If you know anything about sickle cell crises can become even more of an issue for pregnant women. And I had a patient at the hospital I was delivering at. She was not ready for delivery, but she was in a crisis. She was having just pain. Those sickled cells, they're not flowing nicely like a river raft, right? They sickle, they turn like a moon shape, and they get stuck in the vessels, and it just causes pain in every joint. And think about the small vessels, pain can even be worse. And my patient was hospitalized. We were trying to treat her sickle cell anemia, blood transfusion. She had had so many transfusions, it would take days. When she would come in, we couldn't even keep blood on the shelf for her because she had so many other specific type of blood that she needed, because she had developed so many antibodies, which are your body's way of fighting off typically infection, but it was fighting itself. It was fighting the blood. And so you had to find very specific types that would not continue to fight the blood. You don't want to pour blood into someone for your body to just reject it. Okay, so I remember walking out of the room with a nurse, non-melanated nurse, and she said, oh God, I always try not to get upset when I tell this story, but she says, I know why she always comes in here. She just likes that morphine. And y'all, I had to stay professional, and I had to just educate her at the same time. And I said, you clearly know no one with sickle cell. You've never taken care of a patient before. They don't like to be in here. They don't like to have to turn up the volume and keep pumping that morphine pump. But she's in pain. Have you ever known or understand what that means? Have you ever had a limb just twisted on top of itself? Think about your fingers just being twisted, the pain that she must be enduring. So after the apology, hopefully came the understanding. And that if she's still helping to care for women on labor and delivery, or on the floor we call antepartum, where women are pregnant but not yet ready for delivery. They may have other medical conditions, as this patient did. Hopefully she has a little bit more sympathy for her.
I had been going to the doctor for years with heavy bleeding. I kept being told there's nothing wrong with me. A woman can tell her body when something's going on, and I just couldn't accept the fact that they were telling me it's the change of life. Dr. Bird did a pathology report and found out I had cancer. Just her compassion, her bedside manner, her care for me as a patient was just amazing. She saved my life.
Visit Radiant Women's Health in Conyers, helping you shine from the inside out.
Future patients. All right, y'all. I've been talking a lot. But what I wanted to share are some of the, I'll say the highlights of the summary that I shared with the podcaster earlier today that I had an opportunity to speak with. And her question to me was, well, what do we do? How do we arm ourselves? How do we educate ourselves? And how do we survive? Wow, it's nice bright out here. I can't even see now, but how do we survive? And I will tell you how we educate and arm. I said, just like I tell anybody, and I said earlier, you have to know who you're working with, right? You need to know your doctor, your physician. You need to know the personnel that you're working with. Who do I call in the midnight hour? And who's going to call me back? Who's calling me back if I do call while I'm pregnant? Who calls me if I'm scared and I have surgery in the morning and I'm not sure if I want to move forward? Who reaches back out to me? Is there an empathetic or even a sympathetic tone in their voice? Are they educating me, or are they just getting me through the system? Am I just another checkoff? Am I just patient number 17235? You know, how do I feel? Do they know my name? Do you know me? We practice all of these things. Here I go running through these. We practice these things in my office setting because I remind my employees how I treat my patients. Everybody
Thank you for watching. The conversation continues at Dr. Ju Delivers on Instagram and Facebook. Head on over, follow, and get more insights, highlights, and tips about today's episode.
Because
remember, Wednesdays are for pushing wellness for women worldwide.
About her heavy periods, and she feels like everyone writes her off. She may have an attitude because she's just concerned. She's scared. She has a friend who underwent so-called minor procedure and had a complication, and she's just worried about her own story and how it will end. So we don't give attitude back. We stop, we listen, we hear, and we connect. And you need to feel like you connect with your doctor. And if you don't, I would not be going under the knife with someone I did not connect with. Hello? I would not, personally. And I am someone's patient too, right? So you got to connect with them. You got to educate yourself. Now, I will tell you, I'm a little leery when it comes to social media and public reviews. I'll say it that way. Just make sure if someone gives a bad review that they didn't also give Papa John's a bad review, the laundromat a bad review, the movie theater a bad review, because then you can kind of follow the sequence. But if there's several different type of people and they're saying the same thing, you got to look at what is the common denominator and see if you should kind of listen, right? But get recommendations from your family, from your friends. If you're new to a city, ask your coworkers. I remember when I moved to Pittsburgh for training, two things I asked for: where's black church and where's black hairstylists? I asked black nurses, weren't many of them. There weren't many of them. And you go to people that you trust. I know I look a mess, y'all. I'm out here trying to get my steps in before it's time to go. I try not to just talk about it, but I try to live what I teach and preach. So I'm about to sign off here. Did I finish? We talked about how to educate, how to arm. Knowledge is power. I shared this and I just want to share it again. It's important, not only the relationship you develop with your doctor, make sure your doctor is a compassionate doctor, right? They're not just I'm trying not to step on toes, but make sure that they are such a compassionate doctor that they keep your privacy private. I told her, I said, at the end of the day, I know my husband is a huge supporter of what I do. Clearly, we're a team, right? That's what he says. But even when my husband refers patients to me, there is no pillow talk. Yeah, remember that waitress you said to me? No, he doesn't get to hear that because it's your business. So make certain that you believe that the conversations that you're having in that four-walled room is between the two of you. That's why my podcast is called Between You, Me, and the Speculum. It's a private conversation. Okay, clearly, it's YouTube and social media platforms, but conversations that you and I have, if you're my patient, they stay there, they die there. Now, if you're sharing about your child and how they made it to the Olympics, well, I'm gonna brag on you all day long. You know, I just am. But if you share any personal stories or personal concerns about your body, your health, your home environment, that is yours. And I just take it. I leave it there. And I move on to the next one, okay? So if you need to know, if you have a sense of that, you're not a number, you are prioritized. I don't care how many, and we have a lot of patients. All of us do, whether you're in private practice, in an academic setting, and a major institution, large, it doesn't matter. You in that moment in front of me, you are the priority. And you need to feel that way, okay? It helps. It helps, okay? And it helps that you come with that expectation and making sure that you feel that. So we speak all the names. If we had a hashtag for our ladies, I would say hashtag let Black women live. Hashtag Black women deserve to live. So many of our women who have gone on, and so many who have been traumatized, even by the healthcare system. But I believe that we can do better. There's so many trainings out there now. There's so many ways that we are trying to educate. Unfortunately, we could teach a whole lot in medical school, right? But, I'm sweating. We could teach a whole lot, and we are taught a whole lot in medical school. But it's hard to teach people how to be sympathetic or empathetic. So you've got to find that. You can find the knowledge base. Make sure it's a board certified physician, surgeon, therapist, psychiatrist, whatever you need. But the sympathetic part and the empathetic part, you're going to have to gauge and build that relationship and find it. All right? All righty. That was a long one. I wanted to share some names. If you have someone that you want to pay homage to, that is a Black woman in America that I may not have shared, share her story. Comment below. Don't forget to share. Please do. Don't forget to like and subscribe. I'm trying to do better to educate you and to learn and grow. That's the business, okay? Thank you for joining me, Between You, Me, and the Speculum. Until next time, bye.
Thank you for watching. The conversation continues at Dr. Ju Delivers on Instagram and Facebook. Head on over, follow, and get more insights, highlights, and tips about today's episode. Remember, Wednesdays are for pushing wellness for women worldwide. The content shared on Between You, Me, and the Speculum with Dr. Ju is for informational purposes only. While Dr. Ju is a licensed physician, the information provided should not be considered a substitute for professional medical advice. Always consult your primary care physician or healthcare provider before making any changes to your health or wellness routine. The views and opinions expressed are those of the host and do not represent the views of any medical institution or organization.